Hey YouTube,
Hey.
It's Tiff and Steph.
We're back.
Again.
Part 2, PTSD.
Yes, treatment.
So the first treatment you want to do is psychotherapy. This is Tiff's favorite thing. She loves psychotherapy. I love it. I use it as well.
Yes.
CBT therapy, cognitive behavioral therapy. That's what CBT stands for.
Mm-hmm.
That's a very good therapy. Also, for treatment of PTSD, they use exposure therapy, eye movement and desensitization, and reprocessing, which is EMDR.
Yes.
Those are the treatments used for PTSD. Because the reason why we use these treatments is because we want to change the way you think.
Absolutely.
And you get rid of those negative thoughts. It's like practice makes perfect, in other words. You know, when you're young, your parents go, okay, practice makes perfect. If you keep doing this thing over and over and over and over, you'll retrain your brain. And then you won't have this, you won't have these reoccurring instances, negative thoughts.
Correct.
So it's so important to change. You need to find you a therapist. And to find your therapist, you can go through your PCP. You can look online or your OBGYN, because they do treat depression, post-traumatic stress depression, things like that. Postpartum depression. That's what I meant to say. And so we have some medications that we use, and Tiff will be going over the medications.
Okay, so if you're more moderate to severe with the PTSD, like we had mentioned, the moderate to severe PTSD, you're probably going to need medication to stop the flashbacks, stop the panic attacks, stop the nightmares, because that's just like a poor quality of life, right guys?
Poor.
I mean, flashbacks, panic attacks, nightmares, you really don't have to live like that. And so there are medications to help you manage it. I don't know how do you stop nightmares, with healthy eating? I don't know any foods, okay? It may be something out there, I don't know nothing about, you know anything about any, I don't know if asparagus does it. Vitamin D, I don't know what vitamins gonna stop your nightmares, guys. So let's go over the meds. I know y'all not crazy about medication, but it is what it is. Sometimes you just need medication in order to manage some of these disorders, okay? So in order to manage the flashbacks, the panic attacks, and the high anxiety, I absolutely really like Zoloft and Paxil. They are both FDA approved for PTSD.
Yes.
So that's why we're like, you gotta seek help from a provider. First line treatment is going to be therapy.
First line.
That's first line. Then if that doesn't help, then you got to move to the medication management, which is the Zoloft and the Paxil. Then for the nightmares though, because the Zoloft and the Paxil don't really touch the nightmares.
No.
The nightmares is managed by Prazosin. I love Prazosin.
Shout out to Prazosin.
It does. The Prazosin works so good, guys. If you're having nightmares, talk to your doctor.
They can become non-existent.
Yeah, talk to your doctor. And I have used Prazosin a lot in my practice. My patients really like it. There are minimal side effects. No sexual side effects with the Prazosin. I don't get sexual side effects from our patients. They really like it. It's not addictive. None of this medication is addictive. The Zoloft, the Paxil, or the Prazosin, non-addictive. And I kind of like with the Prazosin, my patients will be on Prazosin for a couple months, and then they'll stop taking it because they think that they don't need it. They'll go, I don't have no nightmares, I don't need this, Tiffany prescribing this, I don't need it, right? And then guess what happens?
Wrong. Nightmare.
They come back. They come back.
Yeah, I started having nightmares.
Yeah, so the thing with the prazosin is, unfortunately, if you have severe nightmares, the moment you stop taking the prazosin, the nightmares typically come back. It is a treatment, not a cure. Don't shoot the messenger. Don't shoot the messenger. It just is what it is.
Tell me a little bit about the side effects for the Paxil and Zoloft. What side effects do you see most?
Okay, side effects with Zoloft and Paxil is sometimes, y'all, at high doses, I do see a little bit of sexual side effect.
That's the one that everybody really worries about. I mean, you still have GI, you know, some GI, but
Well, just a little bit of stomach
just a
upset.
little bit of stomach upset.
Just a little bit, but not enough to make the patient want to stop taking it. Low doses of Zoloft and Paxil work really good, guys. They really do, and they'll really calm down the panic attack, keep the anxiety low, keep the racing thoughts low, and it just does a wonderful job at managing the PTSD. So I really like it.
Yes, it's awesome.
Mm-hmm.
So other things you can do, sleep. So like she was saying, the prazosin, nightmares. Usually you can't sleep because of the nightmare. The prazosin will stop the nightmare, therefore you can sleep through the night. Sleeping leaves you less irritable. Just a happier person when you get up in the morning. You're like, ooh, I slept all night long. Ooh, wow. So it's wonderful. That is very good. It also decreases your anxiety the next day when you get up. You know, if you've been up all night and, you know, scary things have been happening, it increases your anxiety. And most anxiety occurs in the morning before you start your day. So getting a good night's sleep
is a big part.
That's a big part of
managing
this disorder.
Absolutely. And then also consider support groups, online support groups to help you with managing PTSD. Just being with other people that share the same disorder also helps. That does help people. That really does.
You are not alone.
Nope. And so look online, and that's why it's so important to connect with a therapist, because they can plug you right with the support groups that are really good. So that's why I really like therapy.
Find a hobby. There, tip and step with our hobbies. You know, that's gonna keep coming out. Find a hobby. Find something to do. Keep your mind off it. Get something to do to distract you.
Yeah, distracting the mind is imperative to managing any mental health disorder. You've got to learn how to distract your mind.
You have to.
You have to. You cannot allow your mind to just race off to the horses. No. Don't do that.
No racing.
No racing.
No racing with the horses.
Don't go with them horses. I'm always bringing them horses. Don't put back in the barn. Where are you going?
I'm leaving. No.
Bring them back.
Come back. No racing off with the horses.
And the hobbies will do that. I'm telling you. If you don't want to take medication, then you got to have your hobbies on deck. Those hobbies got to be there. You got to be ready to go with them every single day. You have to be daily. Yeah, you can't be doing a hobby once a month and think that that's going to manage your PTSD.
Yes. Of course, exercise.
Yes.
There we go, exercise again.
Yes.
Exercise is good.
It's going to lower anxiety.
It's going to lower anxiety.
PTSD is an anxiety disorder.
Also improve sleep. Did you say? Did I go there? Did I?
She's so smart, y'all. When I had difficulty with patients, this is who I call.
Improve the sleep with exercise. Exercise. You're like, oh, I got a great night's sleep. With some prazosin and a hobby.
You're going to feel like a new person. You're going to be like, oh my God, what?
Yes.
You done went fishing, took a walk, and took some prazosin.
And guess what all that's going to do? Improve the relationship.
You going to have a good relationship with somebody?
Oh my goodness, your relationships are going to improve.
Now y'all know relationships is the foundation of quality of life. Now y'all know that.
It is.
Now y'all know that.
Having a good relationship, friends, family, spouses, kids.
YouTube family.
YouTube family. Yes. Awesome. Just do those things. If you need any more help or a comment or something that works for you that we overlooked, please let us know in the comment section, and we will go over it. We read all the comments.
We do. We try to respond to the comments. We do our best to try to respond. And then eat healthy. Don't forget your healthy eating.
Eat healthy.
Helps you think straight.
It does. Clean gut.
Yep.
Better mood.
Yes.
Clean gut improves your mood.
Yes. Better relationships.
Yes.
It all works together.
Yes.
The physical and the mental, they cross over, guys.
Yes.
They cross over, okay?
Yes.
And then lastly, even though Stephanie told me don't put no more lastlies in, she told me.
Should have put a last thing in.
The shower. Remember the shower that I mentioned?
Yes.
I didn't add
right.
it. I'm adding the shower in. I got this tip from my patient. She got this from a therapist. If you're having flashbacks in the shower, she said turn the water on cold. By turning the water on cold, it shocks you back into the present, stops the flashback. Let me know in the comments if that helps you. My patient says it really helps her. So, you in the shower?
Desensitization.
Oh, go on, girl. All right.
Yes.
All right, guys. We love you guys.
Bye.